If you've been driving commercial for 20 or 30 years, you know the road. What you might not know is exactly what's going to come up at your next DO physical and why being over 60 puts a few extra things on the examiner's radar. Here's the straight version. The DOT physical covers the same core areas regardless of your age: blood pressure, vision, hearing, cardiovascular health, respiratory function, musculoskeletal, plus a urine sample checked for signs of conditions like diabetes. That's the baseline for every CDL driver. What changes after 60 isn't the standard, it's how often certain conditions show up and what an examiner is specifically watching for. Blood pressure is the big one. FMCSA guidelines tie your certification length directly to your readings. Stage 1 hypertension, that's a systolic between 140 and 159, may still get you certified, but probably on a 1-year card instead of the standard 2-year. Stage 2 requires treatment before full certification. Stage 3, uncontrolled, is disqualifying until it's brought down. If your blood pressure has been running high, talk to your own clinician before the exam. Don't wait until you're sitting in the exam chair. Diabetes is the next thing to know. Oral medications generally don't block certification, but you'll need documentation from your treating physician. Insulin users have a separate pathway through the FMCSA's Insulin-Treated Diabetes Mellitus Exemption Program. That process takes time, so plan ahead. Sleep apnea matters too. If you have a diagnosis, you'll need to show you're compliant with treatment, usually CPAP therapy. Bring your compliance data to the appointment. Untreated sleep apnea is a safety issue behind the wheel, and examiners know it. Vision standards require at least 20/40 acuity in each eye, with or without correction, plus a 70-degree horizontal field of vision and the ability to read traffic signal colors. Bring your glasses or contacts. Cataracts or macular degeneration don't automatically disqualify you. What matters is whether you still meet the acuity standard. If you're uncertain, get an eye exam first. Hearing is tested with a forced whispered voice at 5 feet. Hearing aids are allowed. Age-related hearing loss is common, and many drivers over 60 pass without a problem. Now, if you don't pass on the first visit, that is not the end of the road. A deferral is guidance, not a verdict. Many experienced drivers come back after addressing a flagged condition and get fully certified. The practical move: gather your documentation before you go. Medication list with dosages, recent labs if you manage blood sugar or cholesterol, CPAP data if applicable. Skip the heavy salt and caffeine the day before. Show up rested. Give yourself enough runway before your current certification expires to deal with anything that comes up.